My name is Dr. Matt Linger. I'm the director of the Rapid Surgical Weight Loss Clinic at Rapid Regional Medical Center. We're here to talk about bariatric surgery and especially who qualifies for it and the types of bariatric surgery and how well they work. The first question is, who qualifies for bariatric surgery? There's a couple of different ways to qualify. The basic rule for most insurance companies is if your BMI, your body mass index, is greater than 35, you probably qualify for weight loss surgery. You come in, we take a look at your insurance, and we can tell you for sure. The best and most durable tool that we have for weight loss is surgery. I believe that just about any of us can, with focus and perseverance, that we can lose 35, 40 pounds. The question that I have is whether or not we can keep it off. Big studies and my own personal experience is that probably 9/10 of us are going to regain the weight. The difference between doing diet and exercise on your own and undergoing weight loss surgery is the ability to keep that weight off. And so let's talk about how bariatric surgery works. We'll talk about the two types of bariatric surgery, and then later we'll talk about what the process is like. There are two big types of bariatric surgery. One of them is what we call restrictive, and that means that we make the size of your stomach smaller. The most popular form of this operation in the United States right now is called a vertical sleeve gastrectomy. Lots of folks will just say it's the sleeve. In the sleeve, what we do is we take your stomach from an organ that's about this big and we turn it into something that's about the size of a little skinny banana. This does a couple of things. One, obviously can't eat as much, and two, it does remove an important part of the hunger center in the body. The part of the stomach that we remove from the body produces a hormone that really drives hunger. And by removing that, we see that one, folks are usually less hungry, and two, they certainly can't eat as much. That's the first type, the restrictive type. The second type is something called a malabsorptive operation. These are bypass operations, and there's a couple of different types of them. The most popular and well-known of these malabsorptive operations is called the Roux-en-Y gastric bypass. Most folks will just say they had a bypass operation. In this one, we do two things. One, we make the size of your stomach smaller, so you physically can't eat as much. And then two, we reroute the way that some of your intestines are connected so that you're not absorbing all of the calories that you're taking in. This one is the oldest, and up until about 15 years ago was the most popular form of weight loss surgery. Both of them work really well, and both of them are durable. We see people that lose 20, 30, 40% of their body weight and keep it off at 5 years. More than that, we see resolution of the diseases that go along with obesity. So for both of these operations, we see remission of type 2 diabetes. 70, 80, 90% of folks who have type 2 diabetes after undergoing one of these operations don't need to take insulin anymore. We see resolution of high blood pressure. About 60%, 50 to 60% of folks are going to either take less high blood pressure medicine, or some of them come off of it completely. And with regards to obstructive sleep apnea, we see many folks that come off of their CPAP machines. We see people that have better joint pain. And in general, getting that weight off helps folks pretty tremendously. These are our two basic types of operations that we do. In later videos, we'll talk about the way that you can go from watching these videos to actually coming into the operating room and undergoing these procedures.